Good afternoon, everybody. Welcome to this live. Thank you for so much for joining us. I'm Dr. Partha Nandi, and really alarming, right? 1 in 9 U.S. women are actually drinking, and some are even binge drinking. So, what's actually happening? Recent information from the CDC, and the CDC is the Center for Disease Control in the United States. And what we're talking about is estimates that current binge drinking in the United States, were slightly higher in 2015, 2017, when the figures were 10.2% and 3%. But I mean, thinking that 1 in 9 pregnant women in the US drink alcohol while pregnant and 4% binge drink, and it's this is a troublesome thing to me. I'll tell you, the US statistics are startling, and the Surgeon General has unequivocally said that, listen, we don't think any amount of alcohol is really safe during pregnancy. So listen, I get it if it was food or water or something that's critical, but we're talking about alcohol. And so, why would you risk the health of your baby, while you're pregnant, and give your baby the toxicity that really it doesn't need, right? So what are the problems? We've known for a long time what the issues are, right? So we know for a long time that when babies are are given alcohol, it's like essentially giving your unborn baby an alcoholic drink, because they're so tiny. The alcohol actually breaks down more slowly and stays in the baby's body a lot longer, and their brains are developing, their nervous systems are developing, their whole body is developing. And so we know that for a long time that drinking while pregnant has a lot of negative health outcomes, some critical, right? So we're talking about birth defects that stay with the child forever, impaired intellectual development, and behavioral problems. And so this is all there, as well as stillbirths and miscarriages. So the thing is that if you're interested in having, a healthy baby, big thing is what? You need to make sure that when you're actually getting ready to have a baby, you need to make sure you stop with drinking whatsoever. It's not critical. It's not essential for your body. So why are we doing that? But the fact that 1 in 9 American women who are pregnant are drinking, and 4% are binging, right? So this is this is incredible. And we know that fecal alcohol spectrum disorders are happening, and lots of issues. And when you look at the pattern of drinking by age in the CDC, a lot of the women that are doing this, right, especially the regular drinking, are 18 to 24. But very interestingly, the people who are binge drinking are aged 35 to 44 years of age. So regular drinking, 18 to 24, women that are aged 18 to 24 are higher, but folks who are binge drinking, it seems like that 35 to 44 age group, which is really interesting to me, because I think that sometimes people say, well, they're young and they maybe don't know. But what about these women that are 35 to 44 years of age? So really, it's interesting. People seem to have, with a college degree, were more likely to drink. Get this: women with a college degree were more likely to drink alcohol than women with a high school diploma or less. So, education's not really playing a part of it. And so, but here's the thing with binge drinking: women with lower education levels are more likely to binge drink. But it's really perplexing to me that if you've got a college degree and you supposedly have a higher education, why would you be drinking regularly? So really is troublesome. And so what do I recommend? I just think that there's really no safe level of alcohol. Unequivocally speaking, there's no safe level of alcohol. If you are getting ready to become pregnant, or getting ready for pregnancy, because some people say, well, the first couple months I don't even know I'm pregnant, right? But what I feel is, when you're getting ready for pregnancy and you're trying to get pregnant, then that's the time to really stop and really concentrate on your baby, and of course stop alcohol, stop any drugs, but also give yourself the best nutrition, right? We talk about with our whole methodology of being your own health hero. Be the health hero for your child as well. Have fresh fruits and vegetables, have antioxidants, good, fermented foods like Greek yogurt, like sauerkraut, like kimchi, like kefir. All these are good probiotics and have lots of fiber that makes your gut healthier, and the gut leads to hormonal health. So when I talk about that, what am I talking about? I'm saying that when you make your gut healthy, then guess what? Your endocrine and your hormonal systems are also healthy. When that happens, this is what takes place, that the hormones that are needed to become pregnant more optimal. So people don't forget about that. What you put in your mouth and in your body plays a critical role in what happens during pregnancy. So really important. And people who have trouble stopping, remember there's many support groups. And if you're having trouble stopping when it's as important as your baby, there may be an issue. Please reach out to local Alcoholics Anonymous or talk to your doctor, talk to your OBGYN, make sure that that's really important. No amount of alcohol is safe during pregnancy, especially during the first 3 months. And no alcohol is good for you at all during pregnancy. But it seems like people who drink beer and more hard liquor seem to have more problems as well. And so really, really critical. 7,000 women between the ages of 18 and 44. Can you believe that? That's to me, I was so surprised. So again, be your own health hero. Remember, no amount of drinking is safe during pregnancy. Unequivocally speaking, you've got to put your baby's health and your health, right, paramount. So remember, make healthy living a part of every day. Thanks for watching today. I will see you next time. Bye-bye.